want to welcome all of you to the San Diego Press Club's Powerhouse panel reporting on vaccine hesitancy. Tonight's conversation is sponsored by the San Diego Union-Tribune. I'm Susan Taylor. I anchored the news for more than 30 years at TV stations in Dallas, Miami, Los Angeles, and then NBC7 here in San Diego, where I anchored the evening newscast for almost 16 years. I left TV back in 2012 to join Scripps Health as the Director of External Affairs, and I now produce YouTube videos for Scripps featuring doctors and patients and the latest technology that is transforming the way healthcare is delivered. You can see those videos by going scripps.org/videos. Let's get started. Actually, I'm a journalist at heart, and I'm a storyteller, and COVID is probably one of the most consequential stories of our lifetime. So we are all very happy to be here with you this evening to talk about this. Let's introduce the panel. First of all, Dr. Susan Bailey. Say hi, Susan. There you are, Dr. Bailey. She's president of the American Medical Association. Dr. Bailey is an allergist immunologist from Fort Worth, Texas. She was elected president of the American Medical Association in June of 2020. Welcome, Dr. Bailey.
Thank you so much for having me.
And also joining us is Dr. Wilma Wooten. She is the Public Health Officer and Director of Public Health Services for the County of San Diego Health and Human Services Agency. Dr. Wooten has a strong interest in health disparities and health equity. She is the current board member and past president of the Health Officers Association of California. Dr. Wooten, thank you so much for being with us.
Thank you for inviting me tonight.
Sure. And then Andrea Lopez-Villafaña. She is a reporter with the San Diego Union-Tribune. She covers the neighborhoods of the city of San Diego. She currently serves as president of the National Association of Hispanic Journalists for the San Diego-Tijuana chapter. Andrea, thanks so much for being with us.
Thank you for having me.
All right, let's all begin. Dr. Bailey, let me start with you. Where do we stand now on the number of people in the United States who have been vaccinated, and also the vaccine supply nationwide, because that has been an issue in the past couple of weeks?
We have really made some amazing strides in vaccinations, although you can always be better. But we are coming up onto the milestone of 200 million doses of COVID-19 vaccines being delivered in the United States. About 37% of the US population has had at least one dose, and about 24% of the US population is fully immunized. We remember back when President Biden was inaugurated, he wanted to have 100 million doses in 100 days. Well, we blew by that one really quick. And now our 7-day average now for administering doses is about 3.3 million per day. The vaccine supply, there have been 250 million doses that have already been delivered. So that means that, there's 50 million laying around in cabinets and freezers in various places. And even with the Johnson & Johnson vaccine being put on pause, which I know we'll discuss later, that's really a very, very small fraction of the total vaccine supply. The United States ordered enough vaccine to vaccinate every adult in the United States 3 times over. So we will have plenty of vaccine. It's not all here yet, but we will have plenty of vaccine.
And Dr. Wooten, talk about San Diego. What percentage of the folks in the San Diego region are vaccinated?
Well, that's a great question, Susan. If we actually look at our goal, our population goal, which is 75% of those individuals 16 years of age and older, 60% or almost over 1.2 million individuals have had their first dose, and 37.5%, almost 800,000 individuals are fully vaccinated. So that's very good news for San Diego.
Dr. Wooten, we can hear you, but we can't see you. I know we were having a couple of technical difficulties. We'll see if we can get your, there you are, there we see you.
There I am.
Talk about the vaccine supply, because a lot of folks have had to reschedule their appointments because the vaccine supply that was promised just didn't show up as scheduled, and it's been very, very frustrating. What has been the cause of those shortages? Is it communication between the state and the county? between the county and the folks distributing the vaccine? Is it just a shortage of supply from the manufacturers?
It is not a communication problem, Susan. This is a nationwide issue. And in the winter months, there was a problem with the distribution because people were at home. They couldn't get to work because of the snow. And then particularly with Johnson & Johnson, there was the 5 million doses that we lost due to a manufacturing issue there. So it is basically the availability of the vaccine that not only San Diego, but local public health departments all over the country have had a decrease in vaccine supplies.
Do you see that changing? Do you see that ramping up and turning around?
Well, that's what we are being told from the federal government, is that, and both Pfizer and Moderna are gearing up to manufacture more vaccines so that more can be available. And I think that's intended to be increased in May. But even despite the shortages, we've been able to vaccinate for the rate of vaccinations in Southern California, San Diego has the highest rate of vaccinations. So we are very proud of that. And that's due to our partnerships.
And I'm going to say this a couple of times during this, but if someone, has an appointment and it gets changed because the supply just hasn't come in, please go to myturn.ca.gov to check and make sure your appointment is there, or to reschedule if the supply is not there. Andrea, San Diego, as we all know, is a very diverse region. We are a border city. Talk about the challenges of communicating to diverse audiences across the Southern California region.
Yeah, I think from what I've seen, speaking to individuals in different organizations that are really working hard to reach certain populations, one of them, the biggest obstacle would be language, right? We have a lot of communities, refugee communities, a Latino community. So a lot of these organizations are taking different kinds of approaches when it comes to sending some of these messages to these communities. From what I've seen is a lot of organizations are taking this very grassroots approach, right? So there's a lot of barriers for individuals aside from language, technology barriers. So I've seen people, knocking on doors, making phone calls, helping people secure appointments, because not everyone, maybe not everyone has a laptop. So that's what we've seen.
Are you finding the vaccine hesitancy among the communities that you're reporting about?
It's really interesting. I think at the beginning, before the vaccine came out, right, when we were back at the trials, and a lot of organizations were really trying to get a diverse group of participants for these trials. In my reporting, I was finding that people had a lot of questions, and rightfully so. I think a lot of communities have been hurt in the past, by medical trials, and there's been deaths, and there's a long history of that, mistrust. So I think at the beginning, people had a lot of questions. They wanted to know, what kind of access would they have if they participated in these trials? And I think as time has gone on, a lot of organizations, partners with the county have been able to kind of answer those questions. There's been a lot of webinars. So I think now what we're seeing is not really an issue of hesitancy, but as I mentioned, access, right? Do individuals have the technology to make these appointments? Do they have the time? They might have, 2 jobs, 2, 3 jobs. Maybe they can't sit at a laptop and refresh to make an online appointment. Maybe there's a language barrier. So maybe there's a transportation barrier. So those are kind of the issues that we're seeing.
Well, there was Dr. Bailey, maybe you want to address this. There was something that I read today which said that the hesitancy is dropping, that it was at 45%, and it's shown a 24% decline. So only 21% now say, no, I'm not going to get the vaccine. So who is, Dr. Bailey, who is showing this, who's hesitant about this vaccine, and why?
Well, there are pockets of vaccine hesitancy really in every part of our country and every demographic in our population. There have been high levels of vaccine hesitancy in people of color, but that is increasing dramatically. And right now, one of the largest groups of vaccine hesitant people are in Republicans and white evangelical Christians, which I find very interesting. And so, as physicians, we're working on, ways to reach all of our populations and try to help folks understand that it's normal to have questions. We expect you to have questions. And the more that you know about the vaccine, the more likely you are to get it.
Is there anyone, Dr. Bailey, who should not get this vaccine?
Well, I'm an allergist, and we know that people that are allergic to certain ingredients in the vaccine should not get the current vaccines at this point in time. We're trying to figure out workarounds around that, but they're not ready yet. We know that, but for pretty much everybody else, there are very few medical conditions that would lead to you shouldn't be able to get the vaccine. And, if you are in doubt, say if you're immunocompromised or, have some other medical issues that you're concerned with, if you have allergies to other medications or other vaccines, and specifically, talk to your doctor, ask your doctor, but chances are you'll be a good candidate for the vaccine.
And Dr. Wooten and Andrea, actually, Dr. Wooten, let me start with you first. What about the folks who don't have access to the internet to schedule their vaccines, who can't get to myturn.ca.gov to sign up? How are you reaching that segment of the population?
That's a great question, Susan. We have various strategies, actually. There's Project Save, there's Operation Collaboration, and then there is a homebound strategy or program. So with Project Save, this is where we have contracted with community partners, and we've allocated appointment visits. We've blocked those appointments that are made available for individuals that do not have the wherewithal to schedule their own appointments. And we set aside those appointments we started off in the South region, and we've expanded this program to the North region. Operation Collaboration is a partnership with our various fire agencies, emergency medical services. And they actually go out to and in mobile outreach teams to provide vaccines at skilled nursing facilities and provide vaccination services to our rural communities. And then we have the homebound program where people are screened in 211 and also in collaboration with our aging and independent services. So it looks at seniors as well as individuals that are homebound at any age. And we also partner with our Alvarado Hospital, Sharp Healthcare, Tri-City, as well as a Chula Vista Fire Agency, and other organizations that focus on the elderly. All of these programs have helped to increase vaccinations for those individuals that would not have the wherewithal to figure out how to use MyTurn.
Okay. And then Andrea, how are you reaching these segments of the population, the folks who don't have access to the internet, who don't have access to social media, to see where all of these different vaccination sites are or where they can sign up?
I've relied a lot on these nonprofit groups, community clinics, grassroots organizations that are really in the community, knocking on doors, calling people and helping them set up appointments. I think that's, especially my job has changed so much from how I used to connect with people. So really relying on these organizations to connect with them. I recently covered an event. It was about 2,000 people got their vaccines, and that outreach was done by volunteers just walking around Logan Heights and neighborhoods in the 92113 zip code, just signing up people for vaccines.
The old-fashioned way, knocking on the doors.
Yep.
Let's talk about, yes.
Yeah, I just wanted to interject this. Many of the nonprofit organizations use promotores, and they go to individuals' homes or call them and help facilitate their scheduling through 211. So that's a strategy through Project Save that we've utilized.
Let's talk about the vaccines now, Dr. Bailey and Dr. Wooten. Well, there's two that come to mind with regard to an association with blood clots. The AstraZeneca vaccine has been linked to blood clots. We're told, though, by the European Medicines Agency that the benefits outweigh the risks. And now, obviously, the Johnson & Johnson vaccine, which is only one shot, has been put on hold because of these blood clots that have happened in 6 women, and 1 woman actually died. Now, there's been 6.8 million doses of the Johnson & Johnson vaccine in the US. So are these two, well, AstraZeneca is not available in the US yet, but are these 2 vaccines safe in your opinion? Dr. Bailey, will start with you.
Overall, yes, I think they're very safe, but it's important to take a very close look at every signal that we see to make sure that there might not be something we might want to do a little bit differently. The Advisory Committee on Immunization Practices of the CDC today did not make a decision one way or the other about the pause for the Johnson & Johnson vaccine. They said we need to look at more data. So what has happened is that the reports from the vaccine adverse events reporting system and all of the, the cell phone texts and stuff like that you get when you get your vaccine, those systems are working incredibly well, and that's how these 6 cases were detected. I might mention that of the hundreds of millions of doses of the mRNA vaccines, we haven't seen that at all. And there does seem to be, we think, something related to the type of vaccine. The AstraZeneca vaccine and the Johnson & Johnson vaccines are made in a similar fashion, and we think that that might trigger an immune response. But I think that right now it's a smart thing to do to look at the data. I'm hopeful that those vaccines will come back online.
And it hasn't yet been proven that those blood clots actually were linked to the Johnson & Johnson vaccine. And Dr. Wooten, you have a personal stake in this because you got the Johnson & Johnson vaccine yourself, did you not?
I absolutely did. It's been over 14 days. I did not have any symptoms associated with the vaccination. I think for the listeners, Mexico also uses AstraZeneca, and they're only vaccinating individuals 60 years of age and older, and they have not had any of this severe type of a blood clot phenomenon seen. So we think it's really related to women of childbearing age. As you know, the 6 cases were in individuals 18 to 48 years of age. In Europe, they have seen over 200 cases. And again, a lot of those cases are also in women. I think there's no clear evidence that there is a link, but the act of taking a pause, reviewing the evidence to determine if there are some specific associations, so that after the committees with CIP, which is an advisory committee to CDC and the FDA, after they review all of the data, they can come out with recommendations. So they might necessarily change the age group, but we just don't know yet. So they're taking their time to review the evidence.
So what do you say to someone who has gotten the Johnson & Johnson vaccine and who are just a little nervous right now?
You know, it's understandable that they are nervous, but I wouldn't spend a lot of time on ruminating over the fact that they might have complications. The complications are very specific. And if it's been, again, over 2 weeks, they should just not be worried that they're going to have this severe blood clot. But
what should they watch out for?
Actually, pain or fever, fatigue. This blood clot can affect the brain, the heart, the lungs, as well as the lower extremities. People can develop deep vein thrombosis. So if they have any of those problems, difficulty breathing, they should see their doctor, get to the emergency room, and be evaluated.
And pain in the leg, right?
Yes, pains in the leg from the deep vein thrombosis.
AstraZeneca says, I'm sorry, Dr. Bailey.
Just headache seems to be a real common side effect that they're seeing between, a week and, 14 to 21 days afterwards. Not right after you get the shot. We think that that's just a normal side effect. But I've had patients calling my office about it that have been worried. And, what we've been telling them is, stay active, stay hydrated, don't change your routine at all. Don't take aspirin because you think it might help thin your blood. Don't do any of that. Just stay hydrated, stay active, and the odds are way in your favor that you're going to be just fine.
Starting tomorrow, vaccines are going to be available to anybody age 16 and up. AstraZeneca says it's pausing its trial on children. Why would a vaccine work differently on children than adults?
Well,
Go
I'd
ahead.
like to start. Yeah. The AstraZeneca trials in the UK are being paused because of the side effects that are seen in the adults, the severe blood clot. So it is out of an abundance of caution that they are doing this to make sure that the vaccine is safe for children based on the results of the investigation that's currently going on with AstraZeneca's pause due to the findings in the UK.
This is all still very new territory for everybody, obviously, but we are seeing a trend of some long-term neurological problems that are linked to COVID. What are those neurological problems?
We are seeing a number of people that the part of the long haulers, as we call them, that complain of brain fog. They just feel like their brains aren't working as well as they used to. We're seeing some issues with coordination, some headaches, long-term headaches, not like the headache that we were speaking of with the specific type of blood clot in the vein. It's interesting, back with the flu epidemic that we had in a 1918 timeframe, it was felt that a number of people developed Parkinson's disease after that pandemic, and it was felt to be related to the flu. We really don't know for sure, but we know this virus can affect the brain, definitely. And it's just depression is another common one. And the fact that, 1 out of 3 patients has reported some, long-term neurologic symptoms is very concerning.
Well, we have at Scripps Health now a recovery program that we have put in place for the folks who are having these long-lasting conditions. And if you just go to scripps.org and then type in recovery, that will give you all the information that you need with regard to this COVID recovery program. Who is it most at risk for these long-term health problems related to COVID?
There's no pattern. Anyone could be at risk, young, old, male, female. So anyone could be at risk. The researchers actually estimate that about 10% of COVID-19 patients become long haulers. And this is according to a recent article that was in JAMA, and a study that was done by British scientists. So there's a lot of work going on across the country. There are clinics in many of the large medical centers focusing on this very issue. The problem is that we have not had enough time to really figure out what are the real causes. And so we continue to collect the data and look at how this condition, neurological condition associated with COVID-19 can be, we can know more about it. We just need more time to find out more.
So are we finding, that all of these unknowns and just not having enough time to know about all the unknowns yet, is this adding to this vaccine hesitancy?
That's a really good question. But I think, all in all, we have to remind ourselves, and especially remind our patients, that the risks of the COVID vaccine are far, far less than the risks of getting COVID itself. And the track record so far for the vaccines has been just amazing in terms of safety and efficacy. So, it worries me that the reporting about the J&J pause and some of the other things the reporting can contribute to vaccine hesitancy if it's not done carefully. And I'm speaking to journalists here, so I know you understand what I'm talking about. And it's important to keep this in perspective, to make sure that you understand the numbers. There are other vaccines that like flu vaccines. There are some known risks to flu vaccines, like a Guillain-Barré syndrome. But we didn't take flu vaccines off the market because we feel like the flu is much more dangerous than flu vaccines. So I have a feeling something might follow for certain COVID vaccines down the line.
So there's a lot of information out there and a lot of misinformation out there. Andrea, what is the role of journalists and communicators during this pandemic?
You know, Susan, I think it's really no different than our role just normally as journalists and communicators. You know, we have to present the facts. We have to push officials for information that the public deserves to know. You know, we have to request information about those outbreaks and where they are, vaccination, you know, efforts. So really it's no different than that. But I think as Dr. Bailey mentioned, it's really important that the facts that we're presenting, you know, are the facts and everything's correct, because there's been so much misinformation. You know, I constantly talking to sources, they see something on Facebook and they think that's true, or they read something and it was wrong. So, you know, I think, you know, our role continues to be the same, but it's so important that we make sure we get everything right.
Well, when you talk about the facts and you talk about, you know, sources, how do you and the San Diego Union-Tribune work to diversify the voices of the community and the experts, you know, when you're sourcing your stories? Because if you're on a deadline, let's say, you might want to just, you know, I'm always going to go back to that source because I trust that source, but it may not lend to the full diversity of the community that you want to reach. So how do you handle all of those different audiences to make sure that you're reaching them with sources that they believe they can trust?
Right. I think we're all, just as colleagues, making a very focused effort to reach out to different groups. But one thing that I've noticed has really worked, you know, I think we've all become kind of like COVID reporters during this time. You know, COVID is not my beat, but really partnering with other reporters I've seen is what's worked a lot. You know, I've partnered a lot with our biotech reporter, Jonathan Wooten. And he's the smart one. He's the he's the one who really understands, you know, all the science and everything behind that, all the data and the numbers. You know, but I'm the one in the community, and I'm the one who can kind of pull those voices from, you know, everyday people who are on the street. So the stories we've worked on, I think, are really great. Yeah, I'm kind of biased here, but I think that, you know, it's a great way of pulling these expert voices, but also bringing in voices from people in the community who we probably normally wouldn't have heard from in some of these stories.
Dr. Bailey, when you look down the road, can you make a prediction? When do you think we're going to return to normal, or the new normal as it is?
Oh boy, that's the $1 million question, isn't it?
Well, where do you see us 6 months from now?
6 months from now, I think things will be more open because we're just on such a great pace in terms of vaccinations in the United States. And I think that as more and more people get vaccinated, the level of cases in the community will have to go down, although it's obviously surging in parts of the country. We may be at the beginning of a fourth wave, we may not. It just definitely in some areas, but it's really very spotty. But I think that it's really just going to take time for people's workplaces to come back to normal. They may never look like they do now. There may be a lot more people that work from home in the future after the pandemic is over than before the pandemic. I think people will certainly go to the doctor differently. Their telemedicine has been amazing, and that will continue. But in 6 months, gosh, I'm hoping that we will have reached herd immunity. And but the variants are really the wild card here, and we need to make sure that we're in a race to get enough people immunized so that there aren't too many cases out there that breed new variants. But I'm very hopeful.
Well, because of the variants, Dr. Wooten, do you think we're going to have to get a booster shot every year like we do with the flu?
Well, you know, Susan, it's quite likely that we will have to, with the change, just as we do every year for flu season, we get a new vaccination because of different circulating strains of that virus. So all of the pharmaceutical companies are looking at boosters, and I think it's probably quite likely that there will be boosters for all of the vaccines in the fall or early next year. But again, we just have to wait and see. I know that many of the pharmaceutical companies are working on that now.
And I know that, the most common sources of the new infection is the B.1.1.7 variant, the British variant. And
Yes.
we see that that's most prevalent in California, Florida, Michigan, and Colorado, Massachusetts, Minnesota. 60% more contagious, 67% more deadly. When you take a look at these variants, do you think, okay, well, I've been vaccinated, could I be reinfected with one of these new, way more contagious variants?
Well, the protection depends upon whether or not that particular strain was circulating in the community when the clinical trials were occurring for the vaccines that are currently now available. And because, say, the South African strain, we have not seen any of those cases here in San Diego, but there have been a few in the US. The pharmaceutical companies are looking at conducting clinical trials, particularly Pfizer and Moderna, to cover that and other variants. So a booster is most likely in our future.
June 15th, we understand that California is set to fully reopen according to the governor. What do you think is going to happen 2 to 3 weeks later? I mean, are we opening too quickly, I guess is the question, because we're seeing more cases tracked to daycare centers, to youth sports. Schools are now opening up. For all three of you, do you think we're opening too quickly?
Well, it's
full disclosure, I'm from Texas, and we opened up last month, and many healthcare professionals in Texas were very concerned that we had opened too early. But we've been okay. We have not seen an increase in case numbers. We have not seen a surge. And so we've still got so much to learn about this virus. But I think whatever, California does, whatever any state does, is that we need to remember, we need to still keep wearing masks. We need to wash our hands. We need to avoid crowded indoor gatherings. I have my own theory about why Texas did as well as it did, and it has to do with that horrible ice storm that we had, where the whole state was completely shut down for a week. And we probably stopped a lot of viral transmission right there, but that's just my own personal theory.
Yes, I agree. The potential for a surge is always there, but the faster we can vaccinate our communities, we can keep surges at bay. But with vaccinations, we will have to also continue those preventive measures, washing your hands, watching your distance, and wearing your facial covering. And if you are sick, don't go to work. Many of our school student and staff cases, and even employees at various businesses, people are going to work sick because they feel they can't stay at home. So stay at home, isolate if you're sick, get tested so you can find out for sure if you're indeed infected with COVID-19. I think the point also should be made that even when you are vaccinated, vaccines are not 100%. And there can be breakthrough infections even in individuals that are vaccinated. So we want people to pay attention to that. And so avoiding large crowds, and if you are in large crowds, again, those preventive strategies, washing your hands, watching your distance, and wearing your facial covering.
Well, that's the question. What about attending these events? I mean, they're talking about opening up stadiums now and opening up to concerts, baseball games. What do you say to folks about people attending events? Should you go? Let's say you haven't been vaccinated. Should you not even think about going to a large event unless you've been vaccinated?
Well, in California, the state has put out guidance for large events like that. And if the business or organization can attest or have evidence that attendees are either tested or vaccinated, then they can increase the capacity of attendees. So that's something that's being worked out. We don't have all of the answers, but the guidance, the beginning of the guidances are out there, and we will just have to see what happens.
Let's see, let's take some questions from our audience. Andrea, has today's social movements such as Black Lives Matter and the Stop Asian Hate, has that impacted reporting during this time as well?
Yeah, I think, we were kind of like in the middle of the shutdown and just getting used to, like I said, all becoming COVID reporters. And then, the protests started, and I think we all became social justice reporters at the same time. So every story that we work on, we really make an effort to look at it through a social justice lens and ask those questions about equity, and really take, as we mentioned earlier, a proactive approach to increasing the diversity of our sources, because every community is different, everyone experiences different things. So just making those efforts there is how that's changed.
Somebody asked a question about volunteering at one of the vaccination clinics, and the one thing she says she noticed was a communications disconnect between the county site and the people who signed up for the vaccination. Many people who came to the clinic hadn't responded to an email to confirm their appointment. They didn't have a computer or a smartphone. They weren't digital natives. What can the county do in the future to communicate health issues to residents who do not have computers or smartphones? I mean, is this basically, what 211 is for?
Exactly. The same strategies that I shared with you earlier. Those are the strategies that we're using to assist those individuals that are not IT or computer savvy. So they can call 211, and there are volunteers that can walk them through the process and help them schedule their appointments.
Someone else has said that they've been invited to attend a wedding in May. It's outdoors, but the couple isn't very COVID aware. Is it safe to attend that wedding? And then I'll take it one step further for both of you, Dr. Bailey and Dr. Wooten. Please talk to us your advice about traveling in general.
Well, first of all, I would go to the wedding only if I'd been immunized and it was at least 2 weeks since my last injection. I would wear a mask. I would socially distance. I'd have some hand sanitizer in my purse. I'd probably wear sunglasses. But the fact that it's outdoors, I think, makes a difference. The air circulation outdoors is much better. We know that crowded indoor gatherings are much more prone to spread the disease. And so if you're immunized and you wear your mask and it's outside, I would think that it's okay to go ahead and go. As far as travel in general, the CDC now says it's okay. I know that there are still a lot of concerns. I heard a report today that having planes not be so crowded and keeping the middle seat open actually does reduce the risk of getting COVID on a plane. I haven't seen the data yet, but so I'm not really sure how they did that analysis. But again, it's that crowded indoor gathering thing. So travel by car, being careful that way where you stay. The mode of travel I think is as important, if not more important, than where you go.
Dr. Wooten, somebody's asking a question. You mentioned that people going to work or school ill. Some do so because they just can't afford to stay home without sick leave pay. How do we address this issue?
Well, back when we had the H1N1 pandemic, various businesses, including the county, created policies revolving around sick leave. And I think businesses have to think about that going forward so that we can allow individuals to take the time off so that they don't infect others at work. Because if a large number of coworkers are sick, then that decreases production or just the work that's being done by that particular business. So these are some long-term strategies that people and businesses should start thinking about that now. And we've been actually before we had our first case of COVID-19 in San Diego, we started messaging that to businesses because we knew the pandemic was coming. So that's something I think businesses, if they haven't done it, that they should really look at doing that so that they can help to protect their workforce.
Someone had said, what about vaccination passports? This person says, I plan to attend a couple of large events in the fall, and it would be nice to know that other people who attend that event also have their vaccination passports and can prove that they've had the vaccination. Now, there's a whole bunch of stuff out there about, you know, some fraudulent vaccine cards being printed for people. So how do we address this issue?
The AMA doesn't have official policy on vaccine passports, and I think it's a matter of, you know, how comfortable do you feel sharing your personal information? Who's going to be responsible for gathering that information? You know, we know what the TSA can do when it comes to being in an airport, but say at a football game, who's responsible for, you know, making sure that everybody's vaccinated? What about children who aren't eligible to get the vaccines yet? So there's still so many questions, and I don't think we have the answers to that yet. And especially when we haven't been able to vaccinate enough of our, you know, citizenry to really make that demand.
Andrea, maybe you can answer this, or all three of you can answer this. For the folks who are vaccine hesitant, how do you get through to them to say, look, it's okay, go get the vaccine? I know that NBC is having a big show on Sunday night, Sunday, April 18th. It's called the Roll Up Your Sleeves Special. And they're going to have a whole bunch of celebrities to basically say, you know, it's okay to get the vaccine, including, let's see, well, President Biden, President Obama, Shaquille O'Neal, Jennifer Lopez, Lin-Manuel Miranda, Charles Barkley, Faith Hill. They're trying to obviously have a very diverse group of celebrities, and also Dr. Fauci is going to be there as well, to say, you know, roll up your sleeves, get your vaccine. How do you reach, you know, aside from this kind of big special featuring celebrities that will be seen nationwide, how do you reach the folks who are vaccine hesitant?
From a local public health perspective, working with your community partners and utilizing trusted and valued partners to be those, the mouthpiece, or to get the message out into desired communities. I think that's one important strategy. But for an individual, I think the very first strategy is for them to educate themselves, not listen to family or friends, but review the evidence, and then they can make an informed decision. And if it takes someone that they trust to be able to make that decision, talking with someone that they might trust, a provider or a community advocate. So I think those are important ways. And holding events like this, I think, is another important way to get the word out so that people learn and know the facts so that they can make an informed decision.
I've done some work with the Ad Council this year, and they have done some amazing research on how to get those messages across. And Dr. Wooten said, you know, the word that's the most important one, and that's trust. You have to have a trusted relationship with someone, whether it's a healthcare provider, whether it is a faith or community leader, whether it's a teacher or professor, you know, whatever. Trust is so important. It's important to communicate the messages empathetically, to encourage questions, to let people know that it's understandable, it's normal to have questions about this, and then to, you know, to share information, and but the trusted relationship, I think, is one of the most important things.
Andrea,
I would
what about
say,
you?
yeah, I would say, you know, as media professionals, again, presenting the facts, I want to give a shout out to our health reporter, Paul Sisson. I don't know how he does it, but he is wonderful and has been covering this pandemic and really, you know, highlighting so many stories and educating a lot of individuals through his stories about the virus, the vaccination efforts. So just want to give a shout out to Paul. but yeah, just presenting the facts, and even us as individuals finding those voices of people who maybe were hesitant at the beginning, right? But maybe they changed their mind, and presenting those stories to people to see, okay, I had the same concerns, but this individual changed their mind, and they're a teacher as I am, or they have children at home, or kind of humanizing the topic for other residents. So I think that's something we can do.
And starting tomorrow, everybody age 16 and over is eligible to get the vaccine. One of the questions is, what's your guidance for kids, though, under the age of 12 attending events?
Well, go ahead, Dr. Wooten.
Well, I was just going to say that the AAP recommends that children 2 years of age and older can wear facial covering. And we recommend that. It's a recommendation, a strong recommendation, but it's a recommendation. And we see a lot of children throughout the community, given the fact that the vaccine is currently only approved for children 16 years of age and older. That is a strategy that we still have, that social distancing. We've heard a lot about that in our schools, and how far away should children be from each other versus children distance from adults. But we have those strategies. So we should continue to use those strategies to help decrease and prevent the spread of COVID-19.
Well, you're talking about the distance of 3 feet away, kids when they go back to school. Mm-hmm. But the question is, when the kids are attending events, let's say they're attending a sporting event, and should they still stay away from their grandparents?
If their grandparents have been immunized, we think it's fine for them to be together.
Even with these new contagious variants.
Well,
absolutely.
Right now, all the vaccines that we have in the United States cover the variants that we see now. So, the CDC has recommended, and, the AMA concurs that, grandparents that have been vaccinated, can be around their grandkids.
Right.
I was so happy to go to my grandson's 11th birthday party last month because we had to cancel the 10th birthday party. And I got the best hug ever. It was just wonderful. But, outdoor events, wearing masks, keeping your hands clean, for adults as well as children, we feel that those things are acceptable.
And while those children certainly can engage with their household members, they want to be social distance from others that are not part of the household. So the entire family should do that.
Somebody's asking that she has 2 very vaccine hesitant family members. Both are buying into extreme conspiracy theories. Is there any realistic way to get through to these folks?
Boy, that's a tough one. There are some folks that we're just not going to convince, and I think we need to, be honest about that. But I think that the test of time, when, millions and millions and millions of people are being vaccinated safely and are doing well and are not getting COVID, I think that's going to speak very loudly. And one thing I didn't mention before, but I think that the Ad Council discovered, and I think is very important, is reminding people of things they miss. Who are people that you'd love to be around, but you can't be around now because of COVID? What are some activities that you miss that you can't do because of COVID? Being vaccinated is really the most effective way to getting back to the things that we love and miss.
I think it's like when you're trying to educate individuals that are smokers. You're not going to get them the first time, every time. You have to go back to them and educate them, continuously educate them. And eventually, some of them will change their opinion or their minds about their decision. So finding out what's important to them, I think, is also important.
Someone is asking that she's read that the vaccine is good for only 6 months. Are we going to have to be revaccinated every 6 months?
That is not true. Many people have misinterpreted the data that came out from Pfizer and Moderna. What those press releases were just a 6-month follow-up of the original vaccine trials. And the news is that the immunity lasts at least 6 months, and we're still following those folks. So it's not like it drops off magically at 6 months. The good news is that immunity lasts for 6 months, and we have no reason to think that it won't keep going. We just don't know how long.
Dr. Wooten, someone's asking if there is a link that we can share for the folks who need need help booking their vaccinations to the homebound. Is there some kind of
Yes,
link?
we can provide that. We can provide that information.
Okay.
I don't have it off the top of my head, but we can provide that information. We can send it out to you before this session is over.
Okay, and then also maybe make sure that Andrea gets it as well, so that she can report on that going forward.
Will do.
And then for the anti-vaxxers, someone's asking, at what point is there herd immunity?
You know,
Go ahead.
That's a great question. And I think it's one to which we do not have the answer. Many of you have heard Dr. Fauci say that we should really step away from saying we're going to vaccinate 70 or 75%, because we just really don't know what the herd immunity is. So what we should focus on is vaccinating as many people as possible.
Amen.
And then we did touch on this before, but let's just bring it up again because people are still asking about it. The latest news about the Johnson & Johnson pause, how likely is that going to affect the hesitancy issue, and how do you as doctors deal with that? Andrea, how do you in the media deal with that?
I'm concerned that this will affect hesitancy because it fuels into some people's concerns that the process was rushed, which it was not, and that the vaccines weren't ready, which they were. And that this is a demonstration that the system works, not that the system doesn't work. But I think it's important to, like I said before, to take things in context, realize that we have given almost 200 million doses of vaccines, and the mRNA vaccines don't seem to have this problem. We're learning about it. And, we are blessed with a choice of vaccines now, and there are more coming online that are even different than the ones that we have now. So, I think it's really good news. But we just have to, we're all so impatient. We want to know right now. And it's going to take a little time to figure this one out.
I think it could go both ways. While I agree with Dr. Bailey, but there are some people that I've talked to where it doesn't concern them because the occurrence of this severe blood clotting disease, the number of cases is far less than the general occurrence per 1 million individuals on an annual basis. So I just think it could go both ways. And people that will look at the evidence, and we have to wait until ACIP, the Advisory Committee on Immunization Practices, as well as the FDA comes out with their assessment of these reports to see if they are indeed linked.
Andrea?
Yeah, I would say, as I mentioned before, reporting on the facts and relying on voices like Dr. Bailey and Dr. Wooten to really explain the subject that they know best. And, also providing some information and putting things in context, right? We want to put things in context and explain to individuals the reason for why we're seeing this and how does it compare to other things.
We're just about out of time. I've got 2 more questions for all of you. What's your biggest fear going forward? And what's your biggest sense of optimism going forward?
Oh boy, I'll take a stab at that. I think my greatest fear is the variants and not being able to get enough people vaccinated. But my greatest sense of optimism is the fact that we have learned so much so quickly about this virus and vaccinated far more people than I think any of us thought we would at this point in time.
Dr.
Yeah,
Wooten?
I echo that. My greatest fear is that we'll go backwards because of the variants or some other reason that we will have a surge. But I am very hopeful, and satisfied by the fact that we have vaccines. If we didn't have vaccines, we would expect with this opening up, we would definitely see surges. We've seen it twice already in California and across the nation. So the very fact that we have vaccines, for me, is very hopeful, and I'm very pleased about that.
Andrea?
I would say my greatest fear, and I'm kind of looking at the recovery period, is, if we do see another surge, what's going to happen, to those businesses that were already, holding on, by their nails. I know a lot of businesses that I reported on originally still haven't opened, and there's a lot of families as well that are also going through a lot of hardship. So I think my greatest fear is seeing that increase. But I am hopeful that we have vaccines and, people are lining up to get them. So I'm hopeful that things will get better from here on out.
Any final thoughts to our esteemed panel? Dr. Bailey, we'll start with you.
Oh, well, first, I just want to, I have done a panel with a group of San Diego physicians a month or so ago, and now this panel with y'all tonight. I am just so impressed with the people of San Diego, how well the organizations work together, your esprit de corps, your dedication to taking care of each other. And it's just such a privilege to be here tonight. We will get past this, but only by working together.
Dr. Wooten?
Yeah, I agree. I just want people to know vaccines, we have vaccines. It gives us hope, but the vaccine is only useful if people get vaccinated. So I'm encouraging everyone in the range of my voice, 16 years of age and older, to schedule your appointment and get vaccinated, because by getting vaccinated, speaking to the economic viability, we can open up more businesses. We can see our family members, our friends. We can travel even, with precaution. But many things that we have delayed for the past year, we can now at least see the light at the end of the tunnel and be able to do some of those things.
Andrea?
Yeah, I would say, our city is strong, our communities are very strong, and I hope that, everyone keeps working together to keep everyone safe. And I just hope, everyone gets their vaccine and hopefully subscribe to your local newspaper.
There we go. I would like to thank our esteemed panel for joining us tonight. And I would like to just say one thing. Please wear a mask. Please continue to wash your hands. Please continue to socially distance, particularly around folks who have not been vaccinated, because there are contagious variants out there. And the last thing that we want is a fourth surge. Yes. So thank you all so much for joining us. And Denise, we'll send it back to you.
Well, thank you, Susan, for just leading this wonderful event tonight. Thank you to our panelists. I think I was watching the chat stream and there were a lot of discussion and excited folks, and they are really appreciative of everybody sharing their time. And speaking about appreciation, I want to say a shout out and a big thank you to our attendees for coming and supporting the mission of the San Diego Press Club. I also would like to thank our event sponsor, the San Diego Union-Tribune, not only for your support tonight, but for your support for many, many years of our club. Just a reminder, save the chat and you can connect with the panelists and the event attendees on LinkedIn, because we've all been sharing those URLs. And remember, we have been recording this session and we will make it available on our YouTube channel. So you can watch it at a later date. You can share it with friends. You share it with family members. As Dr. Wooten said, let's share this within the sound of our voices and get this out there. And for more discussions and career building events, you can go to the San Diego Press Club's website, our social media accounts, and to find out more information about becoming a member of the San Diego Press Club. Thank you for coming and have a great evening. Good night.